Fertility Care is proud to have renowned reproductive male specialist, Dr. Michael Witt. We feel that it's very important to address the male component as well as the female. So today, Dr. Witt's going to speak to us about the diagnosis and treatment options of male infertility. Michael, thank you for joining us.
It's great to be here, Mark.
Could you first tell us what is a male reproductive specialist? What type of training is involved, and what is involved in that type of
Well, somebody who evaluates the male in a couple that's trying to establish a pregnancy and they're having difficulty doing so typically is someone who's had a urology background. So they've done a formal urology training, and then off of that we'll do some subspecialized training specifically focused on male infertility.
Now, this is not a typical common part of all reproductive practices, correct?
That's correct. I mean, most practices primarily focus on the wife, but there are some few, and actually Fertility Care is, I think, the only one in Florida where there is a reproductive specialist specifically for the husband.
So given that 40% of couples are diagnosed with a male factor fertility, what is your first approach to seeing the male and testing?
Well, the approach to any medical problem, even infertility, for the male is the same as you would encounter with any medical practice. So for the men, it's important that they have a very complete history, go through a very thorough physical, and then based on the discovery in those two undertakings, determine how specific testing may be ordered and directed to come up with the diagnosis.
And with a full physical examination and sperm analysis, if that's all normal and the female is all normal, what advantage do you see of using artificial insemination in these couples?
Well, if you have a case where it's completely unexplained, then artificial insemination is a very good form of therapy with very high pregnancy rates. And that's one reason it's important to evaluate the husband, because you want to determine if there is a factor or not. And even if it looks like the husband is completely normal with every test that can be done, then that definitely puts the couple in a unique category with specific treatment options.